Nmc Cbt questions and answers. Question number 501. How do you prevent the spread on infection when nursing a patient with long-term urinary catheters? Option A. Patients and carers should be educated about and trained in techniques of hand decontamination, insertion of intermittent catheters where applicable, and catheter management before discharge from hospital. Option B. Urinary drainage bags should be positioned below the level of the bladder, and should not be in contact with the floor. Option C. Bladder installations or washouts must not be used to prevent catheter-associated infections. Option D. All of the above. The correct answer is option D. All of the above. Question number 502. Which of the following agencies set the standards of education, training and conduct and performance for nurses and midwives in the UK? Option A. Nmc. Option B. DH. Option C. CQC. Option D. ACN. The correct answer is option A. Nmc. Question number 503. According to Nmc Standards Code and Conduct, a registered nurse is excluded from legal action in which one of these? Option A. Fixed penalty for speeding. Option B. Possessing stock medications. Option C. Convicted for fraud. Option D. Convicted for theft. The correct answer is option B. Possessing stock medications. Question number 504. A patient has been assessed as lacking capacity to make their own decisions. What government legislation or act should be referred to? Option A. Health and Social Care Act, 2012. Option B. Mental Capacity Act, 2005. Option C. Carers, Equal Opportunities Act, 2004. Option D. All of the above. The correct answer is option B. Mental Capacity Act, 2005. Question number 505. You have noticed that the management wants all residents to be up and about by 8:30 a.m., so they can be ready for breakfast. Mrs. X has refused to get up at 8 a.m., and she wants to have a bit of a lie-in, but one of the carers insisted to wash and dress her, and took her to the dining room. What type of abuse in place? Option A. Financial abuse. Option B. Psychological abuse. Option C. Sexual abuse. Option D. Institutional abuse. The correct answer is option D. Institutional abuse. Question number 506. A person supervising a nursing student in the clinical area is called as option A. Mentor. Option B. Preceptor. Option C. Intersector. Option D. Supervisor. The correct answer is option A. Mentor. Question number 507. A nurse preceptor is working with a new nurse and notes that the new nurse is reluctant to delegate tasks to members of the care team. The nurse preceptor recognizes that this reluctance most likely is due to option A. Role modeling behaviors of the preceptor. Option B. The philosophy of the new nurse's school of nursing. Option C. The orientation provided to the new nurse. Option D. Lack of trust in the team members. The correct answer is option D. Lack of trust in the team members. Question number 508. A registered nurse is a preceptor for a new nursing graduate and is describing critical paths and variance analysis to the new nursing graduate. The registered nurse instructs the new nursing graduate that a variance analysis is performed on all clients. Option A. Continuously. Option B. Daily during hospitalization. Option C. Every third day of hospitalization. Option D. Every other day of hospitalization. The correct answer is option A. Continuously. Question number 509. You are the nurse in charge of the unit and you are accompanied by fourth-year nursing students. Option A. Allow students to give meds. Option B. Assess competence of student. Option C. Get consent of patient. Option D. Have direct supervision. The correct answer is option B, assess competence of student. Question number 510. Which of the following is an important principle of delegation? Option A, no transfer of authority exists when delegating. Option B, delegation is the same as work allocation. Option C, responsibility is not transferred with delegation. Option D, when delegating, you must transfer authority. The correct answer is option B, delegation is the same as work allocation. Question number 511. In the role of patient advocate, the nurse would do which of the following? Option A, emphasize the need for cost containment measures when making healthcare decisions. Option B, override a patient's decision when the patient refuses the recommended treatment. Option C, support a patient's decision, even if it is not the decision desired by the nurse. Option D, foster patient dependence on healthcare providers for decision making. The correct answer is option C, support a patient's decision, even if it is not the decision desired by the nurse. Question number 512. The client is being involuntarily committed to the psychiatric unit after threatening to kill his spouse and children. The involuntary commitment is an example of what bioethical principle? Option A, fidelity. Option B, veracity. Option C, autonomy. Option D, beneficence. The correct answer is option D, beneficence. Question number 513. In an emergency department, doctor asked you to do the procedure of cannulation and left the ward. You haven't done it before. What would you do? Option A, don't do it as you are not competent or trained for that and write incident report and inform the supervisor. Option B, what is the purpose of clinical audit? Option C, do it. Option D, ask your colleague to do it. Option E, complain to the supervisor that doctor left you in middle of the procedure. The correct answer is option A, don't do it as you are not competent or trained for that and write incident report and inform the supervisor. Question number 514. A registered nurse had a very busy day as her patient was sick, got intubated and had other life-saving procedures. She documented all the events and by the end of the shift recognized that she had documented in other patients' record. What is best response of the nurse? Option A, she should continue documenting in the same file as the medical document cannot be corrected. Option B, she should tear the page from the file and start documenting in the correct record. Option C, she should put a straight cut over her documentation and write as wrong, sign it with her NMC code, date and time. Option D, she should write as wrong documentation in a bracket and continue. The correct answer is option C, she should put a straight cut over her documentation and write as wrong, sign it with her NMC code, date and time. Question number 515. The nurse has just been promoted to unit manager. Which advice, offered by a senior unit manager, will help this nurse become inspirational and motivational in this new role? Option A, if you make a mistake with your staff, admit it, apologize, and correct the error if possible. Option B, don't be too soft on the staff. If they make a mistake, be certain to reprimand them immediately. Option C, give your best nurses extra attention and rewards for their help. Option D, never get into a disagreement with a staff member. The correct answer is option A, if you make a mistake with your staff, admit it, apologize, and correct the error if possible. Question number 516. A nurse manager is planning to implement a change in the method of the documentation system for the nursing unit. Many problems have occurred as a result of the present documentation system, and the nurse manager determines that a change is required. The initial step in the process of change for the nurse manager is which of the following? Option A, plan strategies to implement the change. Option B, identify the inefficiency that needs improvement or correction. Option C. Identify potential solutions and strategies for the change process. The correct answer is option B. Identify the inefficiency that needs improvement or correction. Question number 517. Ms. Castro is newly promoted to a patient care manager position. She updates her knowledge on the theories in management and leadership in order to become effective in her new role. She learns that some managers have low concern for services and high concern for staff. Which style of management refers to this? Option A. Organization management. Option B. Impoverished management. Option C. Country club management. Option D. Team management. The correct answer is option C. Country club management. Question number 518. She reads about path goal theory. Which of the following behaviors is manifested by the leader who uses this theory? Option A. Staff for going beyond expectations by giving them citations. Option B. Challenges the staff to take individual accountability for their own practice. Option C. Admonishes staff for being laggards. Option D. Reminds staff about the sanctions for non-performance. The correct answer is option A. Recognizes staff for going beyond expectations by giving them citations. Question number 519. A nurse manager achieves a higher management position in the organization. There is a need for what type of skills? Option A. Personal and communication skills. Option B. Communication and technical skills. Option C. Conceptual and interpersonal skills. Option D. Visionary and interpersonal skills. The correct answer is option D. Visionary and interpersonal skills. Question number 520. A nurse from medical surgical unit asked to work on the orthopedic unit. The medical surgical nurse has no orthopedic nursing experience. Which client should be assigned to the medical surgical nurse? Option A. A client with a cast for a fractured femur and who has numbness and discoloration of the toes. Option B. A client with balanced skeletal traction and who needs assistance with morning care. Option C. A client who had an above-the-knee amputation yesterday and has a temperature of 101.4 F. Option D. A client who had a total hip replacement 2 days ago and needs blood glucose monitoring. The correct answer is option D. A client who had a total hip replacement 2 days ago and needs blood glucose monitoring. Question number 521. A client expressed concern regarding the confidentiality of her medical information. The nurse assures the client that the nurse maintains client confidentiality by Option A. Explaining the exact limits of confidentiality in the exchanges between the client and the nurse. Option B. Limiting discussion about clients to the group room and hallways. Option C. Summarizing the information the client provides during assessments and documenting this summary in the chart. Option D. Sharing the information with all members of the healthcare team. The correct answer is option A. Explaining the exact limits of confidentiality in the exchanges between the client and the nurse. Question number 522. An adult has signed the consent form for a research study but has changed her mind. The nurse tells the patient that she has the right to change her mind based upon which of the following principles? Option A. Paternalism and justice. Option B. Autonomy and informed consent. Option C. Beneficence and double effect. Option D. Competence and right to know. The correct answer is option B. Autonomy and informed consent. Question number 523. Which of the following actions jeopardize the professional boundaries between patient and nurse? Option A. Focusing on social relationship outside working environment. Option B. Focusing on needs of patient related to illness. Option C. Focusing on withholding value opinions related to the decisions. The correct answer is option A. Focusing on social relationship outside working environment. Question number 524. How to give respect and dignity to the client. Option A. Compassion, support and reassurance to the client. Option B. Communicate effectively with them. Option C. Behaving in a professional manner. Option D. Giving advice on healthcare issues. The correct answer is option A. Compassion, support and reassurance to the client. Question number 525. The supervisor reprimands the charge nurse because the nurse has not adhered to the budget. Later, the charge nurse accuses the nursing staff of wasting supplies. This is an example of option A. Denial, option B. Repression, option C. Suppression, option D. Displacement. The correct answer is option B. Repression.